Hello, my name is Vladimir. I will explain you some details about our new product, UVENT PRO ventilator. Actually, we have two types of pneumatics for this machine. It's turbine-based and compressed air driving. This UVENT PRO with the turbine-based inside. It has the two main parts of the ventilation system. It's a pneumatic unit and the display console. So the pneumatic unit has all pneumatical connections, and this is like a console for the operator to work with the settings and to set up the device. The new features of this ventilator, beside of the existing ventilation modes that you have in existing ventilators, we have almost the same possibilities in providing respiratory support for adult, pediatric, and neonatal patients, but it has some numbers of additional functions, additional features which are coming together with this machine. The most important and the most innovative is metabolic monitoring. So we have the metabolic module, which you connect to the existing CO2 port. You plug and play with the CO2, and the module is measuring breath by breath two parameters. It's a CO2 exhaled or CO2 production and oxygen consumption. By this module, you have a possibility to configure the module, the calibration, the set urine excretion level, measurements, and go to the metabolic monitoring. So here we have four widgets. It's a trends for oxygen consumption and CO2 production, trends for energy expenditures and respiratory quotient GOG, and comparison bars for measured and calculated data. Each and every bar you can analyze with the zoom in, zoom out, and you have a possibility to get the measured energy expenditures for the patient being ventilated in the ICU. The other additional functionality that we have in this ventilator is a USB plug and play additional devices like bronchoscope, or video laryngoscope. So you can just use this kind of device for examination of your patient or even intubation with a difficult airways using the same screen of the ventilator. So here I'm inserting a tube, and then I'm making the intubation smooth and easy with the shortest time for the difficult airways measurement using the interface providing the ventilation support. The other possibility we have in this ventilator to provide a point of care ultrasound using the USB probe to perform the point of care ultrasound for a patient. Therefore, we have dual screen system, because while you're dealing with the POCUS point of care ultrasound, you need to have also data about the respiratory parameters and the status of the ventilation. And as soon as you finished with the examination, you go back to the ventilation process. So all the other parameters regarding this and these devices are almost the same. We have some additional possibilities related to the nebulization. We have the inbuilt ultrasonic nebulizer, the same SpO2 and CO2 monitoring channels, separate channels for auxiliary pressure and cuff pressure monitoring, and all the rest parameters are almost the same. This is considered as a ventilator station or ICU station, which has the same possibilities of compact UVENT ventilators, but with additional features of point of care ultrasound, video.
Calorimetric module work with both?
Yes, the calorimetric module is compatible with the existing devices. So those users who are using our UVENT ventilators, they will be able to upgrade their devices to calorimetry, and having this non-direct calorimetry also in existing devices. The metabolic monitoring is important to have in the ICU patients who are staying for a long time in the ICU, so the doctors will have the most accurate technology to measure the energy expenditures by having indirect measurement or indirect calorimetry, so-called, while the ventilator using the flow sensor, using the volumetric measurements, breath by breath calculating the volume of CO2 exhaled by the patient and oxygen, volume of oxygen consumed during the ventilation process. And by this amount of volumetric oxygen consumed and the CO2 produced, the system calculates the energy which were spent by the patient staying in the ICU. So here we have 4 different widgets that available for a doctor. So first widget is a trend for the CO2 production and oxygen consumption, and here you can see how the data is changing day by day. So it's calculated per day because doctor is interested how big amount of energy spent for last 24 hours to provide the proper feeding strategy for a patient, because underfeeding and overfeeding is a huge problem for patient in the ICU in terms of prognosis for patient life, in terms of death prognosis for a patient. So it's very important for clinicians to track the energy expenditures of the patient, because depends on the progress of pathological process, depends on the actual feeding strategy. It can meet demand or can be underestimated or overestimated. Therefore, the indirect calorimetry is the only technology which gives you exact measured data about this. So the trend is just giving you idea about the volumetric parameters, but here we have another graphs which is representing us the exact graphs of energy expenditures and respiratory quotient. Respiratory quotient is another parameter that I would like to point out. There is a GOG for respiratory quotient which shows you the green zone, yellow zone and red zones, representing the status of the oxidizing substrate. So usually mixed substrate oxidizing with the prevail of hydrocarbons is in the range of 0.98 up to 0.978 or 0.9, and it is considered as a normal respiratory quotient, while the hydrocarbons are prevail during metabolic processes. If there will be a switch, the underfeeding of the patient could cause different shifting in this main substrate which is prevailed during the metabolic process, and then this respiratory quotient will be different, because while you oxidize the hydrocarbons, there are different number of molecules of CO2 and O2 will be used for metabolic processes. So if we have increasing the respiratory quotient, it's basically showing us that fats are entering to the metabolic process of oxidizing, and if it comes over 1, that means that fats are prevail in the metabolic processes. If we are going down, that means that albumins are getting burned during the metabolic process, and it's reflect also pathologic. So here we have like a zone reflects the pathology, and the zone below 0.66 reflects that the wrong measurement is there is a problem in the measurement process, and it is inaccurate, that the doctor have to apply specific parameters for that. And the last one, it's comparison bars, where we have measured energy expenditures in comparison with the well-known calculated parameters from anthropometric data, with the Penn State formula, phases formula, or Ayrton-Jones formula, which is give you a clear idea about calculated and real measured parameters during the metabolic monitoring process. The second screen system is basically required for a UVENT PRO because the main screen can be used for point of care ultrasound, and in this case there will be no ventilation data. Therefore, we have a second screen which is intact. You cannot set up the ventilator from this screen, but it gives you clear idea about the current ventilation process, alarming status, while you're dealing with the point of care ultrasound. That's the main thing while we are applying this dual screen system. But the main point that the ventilation shouldn't be compromised if you're dealing with something else. Therefore, stay informed about ventilation process while you're dealing with the other diagnostic procedures, like a point of care ultrasound, and then go back to the ventilation as well. For live bronchoscopy, you have a possibility to use disposable or reusable USB compatible bronchoscopes that you can use for examination, for intubation, for taking samples, biopsy, but also you have a possibility to connect video laryngoscope, which is also USB, with a plug and play for intubation as well. That's universal system which is using USB compatible devices to have a live picture on the screen of the ventilator.
Sorry, I have no card. I can send the email to you.